The overall impact of the COVID-19 pandemic has been swift, widespread, and stabilizing. The pandemic has had unprecedented repercussions on governments, communities, health systems, and civil society organizations.
We've really focused on the vaccine, on telling people to wear masks and everything, but it has not really looked into the mental well-being of the people. So if the government can offer facilities, there are government facilities everywhere, facilities with counselors where people can go and seek these services, and just encourage people to seek these services, then I think we're going to be able to address this issue. Yeah.
Now, with the specific reference to COVID, first of all, we have to ensure that our programs, the implementation of our program adheres to the Government of Kenya directives for containment of COVID-19, as well as the World Health Organization advisories. So what that meant at a practical level is that we had to cut down on our community interactions. We do not want a situation where our staff are conducting community meetings, bringing to a lot of people in one location.
COVID-19 has highlighted a sharp rise in gender-based violence across the world due to social and economic strains compounded by strict limits on movement.
People have lost jobs. People have slashed, their salaries have been slashed. And at home you're supposed to provide, to pay rent and provide as before. But now you've lost your job, your salary has been reduced, so the stress levels that come up. Most of us do not know how to deal with stress. So you find when maybe your family is asking you for something, your wife is asking you for something, and you're stressed and you do not know how to handle the situation, you find that some people end up fighting or using violence to address the issue that is there.
You remember that as a fact is that apart from Nairobi, Nakuru is the second in terms of the GDP that we sent the national government. And this GDP comes from the tourism sector, because we are quite strong in the tourism sector. And we are also an agricultural hub. And if this continues, it will really affect that, and it will create more poverty and challenges to the community.
Midrift Human Rights Network in Nakuru has not been immune to the pandemic's consequences, with the organization's strategic planning being greatly affected. The disruption caused by the pandemic has forced the management to scale down community outreach activities.
We had to cut down on our community interactions. We do not want a situation where our staff are conducting community meetings, bringing to a lot of people in one location. So large-scale community interventions were scaled down. We encourage staff as much as possible to work from home. Where we do have to have community engagements, then these have to be conducted in compliance with the government directives of the limited number of people, open spaces that are aerated, and keeping social distance.
You will realize that our work is about interacting with the communities, because that's where we want to create change. That's where we want to create resilience. And therefore, with some of these regulations and the lockdown and Ministry of Health protocols, it's very, very hard for us to go and work with the communities, because our work is not based in the boardrooms. The change we want to create at the grassroots level. So this has really affected our work.
Yeah, as an institution, we are forced actually to scale down activities. If we, for instance, we would do around 20 activities in a quarter, then it means you can only do maybe 2 or 3. And those activities either are online based, or maybe if it's physical, then those are activities that we had only targeted very few participants. Then again, even meeting, because the hotels are, some of our meetings are hotel based, hotels have been shut down, you cannot meet there. Then it means basically it means that the physical meetings, we have to, such activities we have to scale down completely or even stop doing them.
At the same time, the organization has experienced loss of revenue in terms of programs funding.
The UK government cut its external funding to their partners, and that trickled down up to the level of the organization, because we have the Reinvent program that had to restructure last year in terms of funding. The programs that are funded by the Ministry of Foreign Affairs in Denmark through Dignity were not severely affected in terms of the level of funding, but the DFID ones were.
With the sudden changes forcing the management to make organizational changes, Midrift has been working closely with government systems and health stakeholders in enforcing the COVID-19 protocols.
What we are also doing is now to create strategies of what can we do with the circumstances, because this is the new normal. So we are trying to map out key stakeholders so that we can be having online meetings. We can also be organizing webinars, at least with the key stakeholders who are mandated to address issues of whether it's security or health. We are also going to make sure that within our own stakeholders, what can they do? And this is a situation whereby, for example, with the Ministry of Health, we have been able to capacity build both the health personnel and also the community health volunteers in their own community, bearing the protocols in place and making sure that those protocols are followed. What can they do at the community level? Because we cannot just sit and be people who feel helpless. We can do anything that can make the situation better.